I'm gonna come right out and say it, hormonal contraception made me depressed. Like many other women of my generation, I was put on birth control at the age of 15 and stayed on it for over a decade. A decade of my life that included a lot of therapy, suicidal ideation, depression, and anxiety. And once I got off the pill, I started exploring other options, only to learn that they too were no walk in the park. The IUD caused both me and my husband pain during sex. The vaginal ring caused my vagina to become dry and overly sensitive, and despite my very best efforts using natural planning, I still accidentally got pregnant. Preventing pregnancy is hard work, and both men and women should be sharing in that burden. In light of several US states and our Supreme Court making it significantly harder for women to terminate unwanted pregnancies, even if their own well-being is threatened, it's more important than ever for men to get involved in preventing pregnancies to begin with. And one of the best and easiest ways for men to do that is with a vasectomy. A vasectomy is a non-surgical procedure that causes the male body not to release sperm, thus preventing pregnancy. But what I've learned in talking to men is that there are real risks associated with this procedure, as well as plenty of myths that prevent them from even considering it. So I'm here to clear all of that up for you. I'm Caitlin V, sex and relationship coach for men, and in this video, I'm going to cover what a vasectomy is. I'll dispel the top 5 vasectomy myths, and I'll talk both the risks and benefits of getting snipped, so that by the end of this video, you'll know whether or not you want to talk to your doctor about the procedure. First up, what is a vasectomy? Well, a vasectomy is a simple and common procedure in which a medical health professional makes a small cut or removes a tiny portion of a man's vas deferens. Vas deferens are the tubes that connect the testicles to the urethra, which is the base of the tube from which ejaculation and urine both are expelled. This prevents sperm from mixing with semen and being ejected from the body, which is what causes pregnancy. Vasectomies do not remove the testicles. I can't believe I have to say this, but it's really important. Vasectomies do not remove testicles. They also do not require any intense general anesthesia, so they don't have to knock you out, you don't have to go to an actual hospital, you don't have to stay at a hospital, and in many cases, they don't even require a stitch or a suture. The pain following the procedure usually lasts for about a week, and for most men, it can be managed with over-the-counter painkillers like ibuprofen. After about 90 days and at least 20 ejaculations later, a sperm analysis is done by a lab to confirm the procedure was successful, after which you are no longer able to cause a pregnancy. Now, you can still pass along a sexually transmitted infection, so if you have multiple partners or a known infection, you will still need to use other forms of protection like a condom. But otherwise, as they say, you are shooting blanks. Vasectomies are 99% successful. They are fairly reversible. Only about 5% of men ever choose to get them reversed, but in many cases they can be reversed, and they generally cause 0 complications. But there are some risks that men should be aware of, which I will discuss in just a minute. But before, I want to address the 5 most common vasectomy myths. Number 1 myth out of 5, my sex drive will decrease. Vasectomies do not affect your sex drive. This is the number 1 myth, and quite frankly, it is a damaging one. If you experience a change in your sex drive after a vasectomy and have no other complications from the procedure, it's likely a psychological, psychosomatic issue that you can work out with a therapist or a sex coach. The majority of couples actually report, and this is scientifically validated, a improved sex life after vasectomy. Which of course, because you're no longer worried about accidentally getting pregnant. Like, cha-ching, that would improve my sex life. Myth number 2 of 5, my testosterone will decrease. Vasectomies do not, they literally cannot affect the level of testosterone in your blood. And I think that men get their testosterone checked after they get a vasectomy, and then they learn that it's low. But they erroneously blame the vasectomy. Chances are that your testosterone was already low well before the vasectomy, had probably been low a long time before the vasectomy, but maybe you never got it tested until you actually got the procedure. And the reason that vasectomies cannot affect the amount of testosterone in your body is because they do not affect your testicles' ability to produce testosterone. They don't prevent your body from absorbing testosterone. Testosterone is made in the testes and gets absorbed directly into the bloodstream, so it has nothing to do with where your spermies end up. That would be weird, because imagine if you were having unprotected sex with a woman and you caused her to have increased testosterone in her body. Like, women who are having unprotected sex would be like roided up little juice monsters if that was the case. All right, myth 3 out of 5, I won't ejaculate anymore. Vasectomies do not affect the volume of your ejaculate. If you have watched my other videos on sperm and semen, you know that sperm only make up a teeny tiny percentage of your overall ejaculate. So you will still be able to shoot the same size loads as you always have. They'll be like 1 to 5% smaller, but I do not think you're gonna notice. And also, don't worry about those little spermies just floating around in space or like existing somewhere random in your body. They all just get reabsorbed by the body, just like all the other sperm that doesn't get ejaculated. Nothing to worry about there. Myth number 4, my orgasm will be less pleasurable. When done correctly, a vasectomy does not diminish the quality of your orgasm. And this is really important to note, because this alone would prevent me from seeking the procedure. Like, sex is really important. Orgasms are really important. So I would never recommend something to you or to anyone that was going to diminish the pleasure available in an orgasm. Now, it is important to know that some men do experience discomfort while ejaculating, especially when their body is healing, and that's normal. Myth number 5 of 5, vasectomies are expensive. That is not the case. In fact, vasectomies are dirt cheap, especially when you compare them to the alternatives. According to the USDA, the average cost of raising a child through the age of 17 in the United States is over $233,000. Most health insurance companies actually cover the cost of your vasectomy, so for you the cost might be $0. And even when a vasectomy is not covered by insurance, the average cost is under $1,000. And $1,000 is about the same cost as 5 years worth of condoms, 4 years worth of the birth control pill, 3 years worth of the birth control implant, 1 IUD that can last between 3 and 7 years, or 2 abortions in states where abortions are legal and accessible. For those states and countries where abortion access is limited, women and pregnant people often have to travel out of state, take time off work, and arrange for childcare, which can actually add up to tens of thousands of dollars. So $1,000 for a vasectomy, which is a permanent pregnancy prevention, a one and done. No more prescriptions, no more doctor visits, no more ongoing expenses. And for those of us who are on hormonal birth control, no more side effects of adding additional hormones into our body all the time. Okay, now that we've busted the myths, it's time to talk about the downside of vasectomies. Because if you ask enough men or spend enough time on Reddit, you will eventually hear a vasectomy horror story. And I want to acknowledge that for a percentage of men, this procedure can leave them with chronic pain, and that is no joke. That is something we must address. The best research suggests that about 2% and maybe as high as 5% of men will experience some kind of ongoing discomfort or pain. This is often diagnosed as post-vasectomy pain syndrome, and that only is true for if that exists after the vasectomy is fully healed. The type of severity of pain differs widely. According to the Mayo Clinic, the pain can range from a rare, dull ache to a sharp, constant pain that can actually interfere with daily life. But for the majority of men, this means an occasional dull ache in their scrotum, sort of like a neck ache or a headache that you would treat with ibuprofen. Unfortunately, it's not really clear what causes some men to experience pain more than 3 months after their vasectomy, while many men don't experience that side effect at all. The good news is that while most men can manage their pain with some over-the-counter pain relievers, others may require pain management or even an additional surgery. The percentage of men who end up with life-changing pain is less than 1% of all men who undergo the procedure. But obviously for those men, this can cause a lot of distress. And coupled with isolation, men can feel like they're not able to talk to anyone about this situation. And it has a huge impact on their quality of life. Also, if you change your mind about your vasectomy, and about 5% of men do, there's a small chance that a doctor will not successfully be able to reverse it. Not to mention that those procedures are expensive and not without their own complications. It's also possible to store your sperm in a sperm bank, which is not an entirely cheap endeavor either. So it's worth making sure before you undergo the procedure that you do not want any more biological children. Let's put these risks into perspective, because as I mentioned earlier, the other methods of preventing pregnancy, which usually fall on women, have risks of their own. For example, hormonal birth control can cause depression, suicidal ideation, and other annoying things like acne and weight gain. IUDs cause some women to experience extreme pain with every period and pain during sex, which was the case with me. Tubal ligation, which is the surgery that's most often compared to vasectomies, requires an actual surgery with general anesthesia, several incisions, and at least a few hours inside of an actual hospital. There's also a greater risk to her because the organs that are nearby where the surgery is taking place are delicate and can be damaged or affected by the surgery. Not to mention that a tubal ligation is way more expensive, again, because it requires an anesthesiologist and a hospital stay. The complications are a lot greater and more severe, the costs are much higher, and the downtime is way more extensive. For me, this isn't even a fair comparison. Yet, I think a lot of us, both men and women, are used to thinking about pregnancy prevention as a woman's issue and something that women are responsible for. And perhaps with the exception of condoms, for the most part, that's been the case. Many, perhaps most men, have had the privilege of enjoying sex for pleasure without worrying about the side effects of reproduction. But that's changing very rapidly in the United States, and men no longer have the luxury of watching from the sidelines. The truth is that abortion has mostly been carried out by women without the average man needing to even worry or know about it. And whether or not you agree that that's right or wrong is beside the point. The point that I want to make here in this video is that if you are a man having sex with a woman, even if you have birth control, even if you have a backup birth control, those things can fail. It is time for men, and if you are a subscriber to my channel, I know that you are the kind of man who wants to take responsibility for his sex life. But I ask that you take responsibility for more than just her pleasure, more than just her satisfaction, more than just having great sex or the frequent amount of sex that you want. Take full responsibility for sex. Take responsibility for preventing pregnancies, and understand with compassion that this is not women's responsibility alone anymore. It could have been in a way, but the US is moving to take that away from women. And so men, if you care about preventing pregnancy, if you care about preventing abortion, then please consider getting a vasectomy. They will not affect your sex drive. They will not affect your testosterone level. They will not affect the volume of your ejaculate. And for less than 1% of men, they will have any long-lasting, hard-to-manage symptoms, which means for over 99% of men, you can safely, cheaply, maybe even free, get a vasectomy, have a one-and-done permanent solution for preventing pregnancy, and you can completely take this out of your bedroom and out of your sex life altogether so that you and your partner never have to worry again about having an unintended pregnancy. Men, I trust you. I know that you want to do well by us, by women. I know that you also want to protect and prevent unwanted abortions from happening, so please do your part and support other men in doing their part as well. No matter where or how you feel about abortions, this should be a pretty easy undertaking for you. Thank you. I'm Caitlin V, and I appreciate you tuning in. Please come back next week where I will post another video to help you have the best sex of your life.